start our briefing with Governor Pritzker.
Thank you very much, and good afternoon, everyone. Welcome back to our 2:30 public update. Today, Tuesday, May 12th, is International Nurses Day, a date that was chosen to honor the birth of Florence Nightingale, the founder of modern nursing. And it's particularly apt that this year we celebrate the bicentennial of her birth, in a moment when the incredible work of nurses is more essential than ever. To all the nurses who call Illinois home, I want to share my personal appreciation and that of a grateful state for the bravery that you've demonstrated in our fight against COVID-19 and for the selfless acts that you were already doing every day before this pandemic started, easing the suffering of those who are sick and even dying. Thank you for answering the call to save lives, to comfort those in pain, and to make a difference for countless patients and their families. We are so very proud of you. And now I'd like to turn it over to Dr. Ngozi Ezike for today's medical update. Doctor?
I will start with the positivity rate statewide, which is 18%. It is important to note that the positivity rate is calculated on a 7-day rolling average with a 3-day lag. That means that for today, we looked at the number of positive and total tests reported from May 2nd to May 9th. And the 3-day lag also allows time for more complete data to come in and for us to ensure the accuracy of the numbers. Trying to report the positivity rate each day would show varying fluctuations in the rate. For example, if test results were largely from congregate settings where we have been seeing higher rates of positivity, you would see a much higher rate than what you would see in a broader slice of the population. So we continue to work day in and day out to provide you data in a timely manner, but we also want to make sure that we are using it with you, the public, to inform the actions that we need to take to reopen. Now let's turn to some of the latest data in the last 24 hours. To date, 471,691 tests have been performed, of which 29,266 were reported in the last 24 hours. Regarding hospitalization, 4,626 people were reported to be in the hospital with COVID-19, and of those, 1,215 were in the ICU with 730 patients on ventilators. Since yesterday, 4,014 new cases were reported for a total of 83,021 cases for Illinois. Unfortunately, this includes 144 additional deaths for a total of 3,601 lives lost to COVID. I know some people have had concerns about the number of COVID-19 deaths that have been reported. Some are concerned that the numbers are inflated. Others think that the numbers reflect an underreporting. In Illinois, we are reporting those deaths that have laboratory confirmation, meaning that they have been tested and a laboratory confirmed test indicates that they were COVID positive. As we learn more about the disease, there may have been less typical presentations of COVID-19 that were not appropriately attributed to COVID because there wasn't a test done because the suspicion was not there. There is also some additional deaths that happen in someone who happened to be COVID positive, but where the COVID infection had nothing to do with the deaths. So we are at IDPH trying to remove those obvious cases where the COVID diagnosis was not the reason for the cause of death. So if there was a gunshot wound, an acute gunshot wound, if there was a motor vehicle accident we know that that was not related to the COVID positive status. But in a case where someone was elderly or battling cancer, it is obviously less clear that the COVID-19, the disease associated with the coronavirus, didn't actually play a part in hastening the deaths. So those deaths do stand. Individuals who do test for positive for COVID-19 and die with illnesses or complications caused by the illness are definitely COVID deaths, and those continue to be counted in our count. We will continue to work to provide data quickly and responsibly and accurately represent what we are in fact seeing here in Illinois. We will continue to stay the course, and we ask you to do the same. We have to do this together. Let's keep going on. For every person's life matters, and we're doing this for all the communities across the state of Illinois. And with that, I will summarize my comments in Spanish. Buenas tardes a todos. Hoy empiezo con el número de positividad en todo el estado, que es 18%. Es importante tener en cuenta que el número de positividad se calcula continuamente por 7 días con un retraso de 3 días. El retraso de 3 días nos da tiempo para que ingresen datos más completos y para que podamos verificar los números para una mayor precisión. La razón de esto es para ayudarnos a identificar una imagen más precisa de lo que estamos viviendo. Intentar informar el número de positividad cada día podría dar una imagen inexacta de la cantidad del virus que circula en su comunidad. Estamos trabajando cada día para compartir datos lo más rápido posible, pero también queremos reportar en manera responsable. Esto ayuda a informar qué acciones debemos tomar para volver a abrir el estado. Y ahora más hechos de las últimas 24 horas. 29,266 pruebas fueron reportadas en las últimas 24 horas. Al respecto a las hospitalizaciones, se informó que 4,626 personas estaban en el hospital y de ellos 1,215 pacientes estaban en la unidad de cuidados intensivos y 730 pacientes estaban en ventiladores. Desde ayer se reporta 4,014 casos nuevos para un total de 83,021 casos de COVID-19 en Illinois. Esto incluye tristemente 144 muertes adicionales reportadas desde ayer para un total de 3,601 vidas perdidas. Sé que a algunas personas les preocupa la cantidad de muertes de COVID-19 que se reportan. En Illinois estamos reportando sobre las muertes confirmadas por laboratorio. Eso significa que han sido analizadas y un laboratorio confirmó que la prueba fue positivo por COVID-19. Las muertes en las que la persona dio positivo por COVID-19, pero no se cree que su muerte sea causada por el virus, se consideran asociadas a COVID-19. Ejemplos de esto incluyen individuos que dieron positivo para COVID-19, pero murieron por alguna otra cosa, como un accidente automóvil, un homicidio o un suicidio. IDPH no incluyen esos números en sus reportes de muertes sobre COVID-19. Las personas que dan positivo por COVID-19 y mueran por esta enfermedad o complicaciones causadas por la enfermedad son muertes relacionadas con COVID-19 y están incluidas en el número de muertes. IDPH continuará trabajando para proporcionar datos de manera rápida y responsable que represente con precisión lo que estamos viendo en Illinois. Por favor, escúchame. Todavía tenemos que seguir el paso, por lo que tenemos que hacer juntos. Lo haremos por cada persona, cada comunidad y por todo Illinois. Muchísimas gracias. And with that, I will turn it over to Governor Pritzker.
Thank you very much, Dr. Ezike, and I very much appreciate your report and, of course, your translation into Spanish. I want to begin today by speaking about just the number of tests that were done in the last 24 hours, because it's worth noting. I don't think Dr. Ezike got to announce this number, and it was 29,266 tests. And although some of those are tests that were not reported in a prior day, the over 20,000 of those were performed in the last 24 hours. So we're very pleased with the progress that we're making on testing. Throughout this pandemic, I've said, and Illinoisans know, that the battle against the virus has been fought on two fronts: that of public health, of course, and to preserve the economy. The damage that this virus has done to jobs and businesses has really been devastating. National projections show some industries will begin recovering in the reasonably near future, and still others may take longer. Meanwhile, workers and their families are hurting. Federal relief has helped in the short run, and the state's support systems have provided a safety net to address the immediate financial pain. From early on, my administration has worked to support our residents and small businesses by banning residential evictions, by providing help to pay rent and utilities, delaying tax filing deadlines, expanding unemployment eligibility, and instituting loan and grant programs to support small business owners. But that isn't enough. We must do more. The legislature must convene so that we can begin to put our financial and economic house back in order, even as we battle this terrible virus. The General Assembly needs to pass a comprehensive plan to support families, small businesses, and small towns. The Congress is looking at supporting the states, and we need to make sure that we are supporting the people who make our economy go. In addition to significantly increasing rent assistance for families and working with banks on mortgage forbearance, we need rent and mortgage assistance for small businesses too. We ought to provide grants and loans for businesses starting and restarting, and tax credits for small business job recovery. Industries and businesses left out of the federal PPP should be first in line. And we must pass a law to distribute funds to small cities and towns to support their need to fund first responders and basic services that could fall apart from COVID-related revenue losses. As we work to keep our residents safe and gradually reopen businesses, I hope the legislature will act expeditiously to support jobs and economic recovery. Until then, I will continue to implement programs that are within the purview of my role as governor. To that end, today I'm announcing a program to provide $25 million in Dceo grants to help local governments jumpstart public infrastructure projects for the summer construction season. These grants are part of a $50 million program through Rebuild Illinois that we're expediting to help cover local projects that may have otherwise been canceled due to revenue loss related to COVID-19. This will keep key public infrastructure projects in the pipeline and will support the return of skilled labor to job sites for the busy summer season. Starting today, local governments with shovel-ready projects, including school districts, townships, and other entities, can apply for this funding. For those that need more time, the additional $25 million will be available through June 30th. I encourage representatives from any community in the state to contact Dceo for assistance. Funding will be prioritized to underserved areas and projects located in opportunity zones, though all communities are eligible. Dceo will begin to host webinars this week to assist local governments in the application process. Information on sign up is available and will be available on the Dceo website. As a reminder, more than $90 million was made available to small businesses through Dceo in response to COVID-19. Our $14 million in emergency hospitality grant funding was distributed to 700 businesses across more than 270 cities and towns in Illinois, providing help to restaurants, bars, and hotels to keep up with operational costs during this immensely challenging time. And Dceo is still offering tens of millions of dollars through two additional sources of support for our residents: our Emergency Small Business Loans Program and our Downstate Small Business Stabilization Fund. These programs can be found online at coronavirus.illinois.gov or on Dceo's website. I also want to highlight a new source of financial support out of the Illinois Department of Healthcare and Family Services to help our hospital systems, many of which are facing a shortfall in revenues due to their need to provide capacity for the potential influx of COVID-19 cases. This hospital stability payment program runs through the end of June, and HFS has already begun the distribution of $75 million to hospitals across the state of Illinois. The last 2 months have made exceptionally clear how critically important strengthening our hospital system is for communities across Illinois, not just in times of emergency, but as a continuous source of medical support for our residents, as an employer, and as a way to put an end to long-standing disparities in healthcare access and delivery. Our healthcare providers are seeing us through this fight against COVID-19, and I'm committed to ensuring their long-term survival and success in every way that I can. So I appreciate very much everybody tuning in. Thank you very much, and I'd be happy to take any questions from members of the press.
Jim Williams with CBS is our first pool reporter.
Good afternoon, Governor. From my colleague Tara Molina of CBS 2, we've heard from dozens of people who have waited 6 to 8 weeks for their key bank debit cards. They cannot access their unemployment benefits and they can't get through to Key Bank for help. Specifically, what are you and IDES doing to fix this and make sure Key Bank is doing its part here?
So we've been in contact with Key Bank. They certainly have the obligation here to do what's right, to make sure that those cards are being charged appropriately. That is to say that there are deposits made in those accounts. Many people, though, received cards that do not associate with an amount that's in an account, mainly because those cards are distributed even before people actually qualify for unemployment insurance and unemployment benefits. So there are people that have not gone fully through the process who've received a card and may not be able to use that card because they have not been confirmed as an unemployment benefit recipient.
From John Garcia, ABC 7, he would like to ask you about the letter you received from Elmhurst Mayor Steve Morley yesterday. A number of mayors in DuPage County would like to reopen their towns. They say they don't want to be lumped into the Chicago area. They claim they are much safer and are able to reopen safely. And Phil Rogers of NBC5 adds, the mayor says their numbers show different trends and that it really is not appropriate for them to be included together.
Sure. Well, I'll reference you to the comments that I made yesterday on this exact topic. And that is that everybody would like to draw a different map. There's no doubt about it. We wish that there was a federal plan, a national plan for reopening, but there isn't. And so it's been left to the states. We, in fact, decided that it was very important for us to operate in a regional fashion. Some people would like to open city by city or town by town, county by county. That's 102 counties, 1,200 to 1,300 towns and cities across the state of Illinois. It was important to us to make sure that on a regional basis, we were, in fact, noting the differences from one area to another, and we did that. But remember, the regions are drawn in a way to take into account hospital availability and to follow the metrics for each region appropriate to a region that is near a large metropolitan area like Chicago. Many people that live in DuPage County work in Cook County, travel between the two, and that's one of the reasons why there's a danger to people who live very nearby, because as they travel to and from work, they have the potential to carry the virus back and forth. So I appreciate that everybody's got a different idea, but I will say this, that if you follow the regional metrics, that each of our regions, including the Northeast region, which includes DuPage County, is reasonably speaking on track. You know, I mentioned yesterday, all of the other regions are on track to meet all of the criteria, and the Chicago and Northeast region are very close. And it is a 14-day metric on the COVID positivity number. And in fact, that number is heading south. So I would just keep an eye on that number, and that will allow those areas to open up sooner. But take note that it's a 14-day measurement for that.
Governor, we have reporters or questions from 3 reporters approaching the same theme. Cisco Cotto of WBBM News Radio, what are your concerns about Indiana reopening sooner than Illinois? And does that mean Midwest governors are no longer working together on reopening plans? Elizabeth Matthews of Fox 32 is asking about Wisconsin. Have you talked to Governor Evers? Wisconsin has essentially opened up all retail today with extreme restrictions. And from Lourdes Duarte of WGN, what are the conversations like with those governors? How concerned are you about people traveling to some of those other states?
That's a lot of questions lumped together, I know. Let me start by saying that as governors in the Midwest, our Midwest region, we talk to one another and our staffs talk to one another quite frequently. We are sharing ideas and making sure that we're following best practices. It is different from one state to another. Indiana is a different state than Illinois. We have different concerns, and Michigan's different as well. So is Ohio. So each of us have different timetables. It's, again, based a lot on, at least for Illinois and for many of the other states, based on healthcare metrics. So we're following, you've seen what we've put out as a Restore Illinois plan. It is, if you look at what the president's plan is, where you would have to have all the numbers dropping over a 14-day period, ours is actually somewhat easier to meet. That plan would be. We might open the state, if we were following the president's plan, Illinois might open at a later date than the one that is currently set in metrics. Having said that, each state is slightly different. And our Midwest Compact is really about a shared set of ideas and a shared set of principles for contemplating reopening. Doesn't mean that we're going to have exactly the same timetable. And indeed, like I said, much of the state, it looks like, maybe the entire state, will begin to move into phase 3 at the end of May, which is just a couple short weeks away.
Have you had conversations with those governors, the governors of Indiana and Wisconsin, and are you concerned about people traveling to some of those states?
I am concerned because I think that in many ways that opening too early or the potential spread of the virus in those states will affect our metrics in Illinois. So I understand that people may cross over the border, but I think they should take into account the danger, the potential anyway, for the spread of the virus and their ability to carry that virus back over the border when they come back, bringing it to their family and their community, affecting not only the health and safety of people in that community, but also the ability of their region to meet the metrics that we've set.
From Greg Bishop of the Center Square, what is the state doing to make sure there will be enough accessible, affordable, and available childcare for people to return to work in phase 3 of your plan, even though daycares won't reopen until phase 4? And will children and childcare workers be required to wear masks and socially distance?
Well, we in fact have opened childcare, as I think Greg knows and others know. We put in place what we referred to as emergency childcare, which really was a downsized version of existing childcare facilities. we didn't think it was safe, and the doctors, most importantly, didn't think it was safe to allow dozens and dozens, potentially 100 children to populate a single childcare facility. So what we did was sought out the creation of smaller emergency childcare providers. And there are 2,500 of those, indeed more than 2,500 now. Many people continue to sign up to do that, existing providers. They actually get paid more on a per child basis than they were when they were running their larger facilities, because we wanted to make up for the cost of having a smaller number of children in each class. So we believe that we will have childcare available to people who will go back to work with phase 3, but we also have created a task force to make sure that we're creating as much childcare as will be needed in that phase and beyond.
From Amy Jacobson of WIND Radio, on a daily basis, you mentioned the models, the science guiding your positions and policies, yet aren't these the same people who are wrong about the hospitalization rate? Remember saying 40,000 people would be hospitalized in late April, when in actuality it was 4,800. Why not consult other models and scientists?
Well, actually, Amy, I think you missed the point of it. We have consulted scientists and doctors all over the country, and we continually ask those, not just in Illinois, but elsewhere. Now, you may have noticed that some of the models, including the one used by the White House, has changed quite a bit over time. The projections for Illinois were so much different over the course of the last 2 months. They've changed continually. One of the reasons that the number of deaths and the number of cases has gone down in Illinois is because of the mitigation efforts that we put in as a result of what we could see were the projected numbers, the projected cases, the projected hospitalizations and deaths. So we knew that we needed to make the stay-at-home order, to build it in a certain way to make sure that we had face coverings required, for example, which helps to bring down and bend that curve. So we're actually doing quite well with the advice that we're getting. Our models have been very helpful. And as you well know, every day that we have new information, it gets plugged into the model and it affects the shape of the curve. So it's not, remember, I gave an entire set of remarks maybe a week ago about the full understanding of how a model works. So I would refer you back to that.
From Chris Coffey at NBC5, are there any state of Illinois plans to assist landlords who are being impacted by missed rent payments? Is the state in favor of proposed city rent relief ordinances that would give renters a year to pay back rent, for example?
Well, I'm not sure the state is going to take a position on a city proposal, but here's what we're doing. We are providing rent relief at the state level through the Department of Human Services and as well as utility payment relief. We also, as you know, have banned evictions in the state during this crisis, and we've also gotten a moratorium from the major utility providers, a moratorium on shutoffs. So we've done quite a lot. I think we need to do more, and I'm calling on the legislature, in fact, when they get together, to increase the amount that we're providing for those relief programs, particularly for rent relief, because there's so many people who are struggling right now to pay their rent. We also have to keep in mind, of course, that there are people who are owners of a duplex, let's say, and they've rented out half of that, or they've rented out a room in their own homes to people, and that was their primary source of income. And so for someone to simply not pay them for a period of time is a hardship for them. So we want to make sure that people can pay their rent, and we want to provide the assistance that's necessary for them to do that.
From Tia Ewing of Fox 32, a suburban woman from Chicagoland called the hotline nearly 500 times. At times, she got a busy signal. At times, the call went mute. She eventually got someone to call her back from IDES. What is wrong with the system? Why are the unemployed still having issues with filing? What upgrades have been made to the system?
Well, many upgrades have been made. And again, what we've encouraged people to do is to go online to file. To the extent that they do that, they are very, very likely, and I talked about this a week ago as well, to be able to get through and file online. For people who absolutely need to speak with someone, we have upgraded and significantly expanded the number of phone lines and the number of people answering those phones. And I know that staff is working day and night to try to not only answer the phones, but also get back to people on a timely basis.
Marianne Ahern of NBC5, and this is addressed to Dr. Ezike. I don't know if she can answer this question for us, but the CDC waits to confirm COVID-19 deaths, but there's a belief that Illinois assumes COVID-19 immediately. Why not follow the CDC guidelines and wait?
I think we've maybe addressed this issue when the deaths are reported to us, and if they have COVID-19 on the death certificate or on the data that we're looking at. Again, we are reporting out the information that's reported to us, and we're really turning it over pretty quickly as we're trying to give it the next day. Sometimes after further review, we will see that maybe like a motor vehicle accident, as I mentioned, or if it was a gunshot case, a homicide case, if we see that that was included in the numbers, you know, we would have to adjust those numbers. So we are trying to make sure that things that really are not at all related to the COVID diagnosis, we want to remove those. But again, in situations where someone had another illness, if they had heart disease and then they went on to have a stroke or some kind of related cardiac sequelae, it is not as easy to separate that and say that COVID did not play a role in an exacerbation of an existing illness. And so that one would not be removed from the count.
Thank you, Doctor. This is for the governor from Craig Wall of ABC7. Governor, can you please respond to the continuing criticism of your Restore Illinois plan? Former Governor Bruce Rauner said, when did the policy goal shift from flatten the curve to keep everyone safe? The latter is not possible, according to the former governor.
Well, I saw what the governor said, what the former governor said, and all I can say is that I'll readily admit that a primary policy goal of mine is, in fact, to keep the people of Illinois safe.
From Frank Whitaker of NBC5, Vice President Pence has called for all nursing home residents and staff to be tested for COVID-19. He's asking every governor to focus on this over the next 2 weeks. Will this be done in Illinois?
Well, we've been doing this for quite some time already, but I'll turn it over to Dr. Ezike to talk about the progress that's been made. I will say I was surprised to hear him call for it, given that we've really been at this for some time, and every governor that I've talked to, frankly, has been at this. So I'm not sure if it's a timely call or a bit late.
Yes, just to echo that, again, more than 2 months ago, we were in nursing homes testing. After even an initial case, we went in and tested the whole facility 2 days later, and the staff as well. So this is something that we have been trying to do. Of course, earlier on, there was a severe limitation of supplies, which made our efforts, we couldn't be as comprehensive and as expansive as we can do more now. So absolutely, we have been on that path for over 2 months. As we have been able to increase our capacity for testing, we're able to do more and more facilities. So we are already well on our way towards that goal.
This is from Eric Hong of ABC7. It's for the governor or Dr. Ezike. If we're now going to peak around mid-June and most of the state will likely move to phase 3 by late May, is it possible we may not come down off the peak and just be in an extended plateau for the foreseeable future?
I'd like to turn that over to Dr. Ezike. I'll just say it is, of course, possible that we could extend the peak. I mean, you've seen that, you know, the projections were that we would peak in late April, and then that frankly, because we've done a good job of flattening the curve, it pushes out that peak and flattens it for a longer period of time. And here we are in about mid-May. We've flattened the peak. I mean, thank goodness, because otherwise it would be going up. But my hope is that it will head downward. You know, and again, by mid-June, I'd like to see that. But Dr. Ezike, you may have some comment about that.
No, I think understanding what we mean by peak is that there's a top point, right? And so if we just stay flat, there's no top point. So in effect, your highest point will be where this plateau is, and that's what we want it to be. We want to know that this is the highest a number of hospitalizations, the highest number of cases, and that we're at the highest number of fatalities we'll see, and that from here we go down. So that would be a good thing if that's where we're at. And it's hard to know if this is the top until we start heading down. And so until we actually start the decline, we just know that we've been staying flat. And so again, we're all hoping the same thing, that we are absolutely at that plateau, that highest point, and that from here on we go down. Obviously, we'd rather stay flat for an extended period than see this plateau and then ascend to another level. But again, we are following the data just like everybody else in the state is, and we are all hoping the same thing.
My last question for the governor or Dr. Ezike: the city is separating settings, prisons, nursing homes, when determining the positivity rate. Might the state do the same? If not, won't the city and state have different metrics?
Well, I think it's helpful for cities to set metrics for themselves. And as you saw, I think, in one case, a 30% positivity rate, in another case, a 15% positivity rate. Those are reasonable. I think if you blend those together, as you know, you end up with roughly the positivity rate that we've set as a cap. So I think it's fine. I will also say that, we are, as the city is, focusing on these congregate settings as places that will have higher positivity rates and where you do need to focus attention. And we've been doing that since the very, very beginning of this crisis, because if you can bring down the positivity rates there, then you, of course, bring down the positivity rate of the staff that works there, the people who come in and out every day, who take that virus. If they were to contract it in a facility, they take it back into their communities. So the more we can do to address those congregate facilities, the better the community will do overall.
All right, that's it for me. Thank you.
Rick Pearson of the Chicago Tribune, you're up next.
Thank you, Governor. Appreciate the time. A number of questions from throughout the state, but I'd like to start first with what you talked about today. Do you have an approximate size for a state-funded based relief package that you're looking for from the legislature? And if you want them to move expeditiously, why not call them into special session to do it?
Well, indeed, I've been encouraging the legislature to do that. Remember that there are a lot of challenges for them. Legislators, just because you call them into special session does not mean they will show up. And they have to have confidence in the plan for showing up. And that means that the leadership, both Republican and Democratic, need to agree to a plan that's been reviewed by the Department of Public Health. We want them to get together. And you saw, I think there was a memo that ended up in the hands of the media that we provided to the leaders to show them how they could get together. But it's important for the members themselves to agree on a plan, the leaders and the members, so that they'll all want to get together. Remember, there are a lot of people, legislature, 77 members and the staff that they may need, but all the very many other people who work in and around the Capitol when the legislature is in session. As to the size of a relief package, we're working on that. I have talked to members of the legislature about that. It's a common concern for us to make sure that we're addressing the needs of families and small businesses. And I would just add that the size of a package will in part be dependent. In fact, it'll be significantly dependent upon whether or not we are able to get relief from the federal government for the lost revenues of lost sales tax revenues and income tax revenues to the state that we're still seeking. And we believe there will be a package and that it will be passed over the next couple of or 3 weeks.
Related question, kind of budgetarily, what's going on as far as adjusting your plans to fill the budget hole after that $1.2 billion bond issuance was postponed?
Well, the bond issuance is, as you refer to, is simply working with the underwriters to make sure that they've got the right pricing and do it in a way that will affect the state in a positive way. So that's still going, and we expect it to complete. But our focus here is on the overall budget for FY21, where there's a significant need for revenue. One of the things that affected the revenue for this year was the fact that we postponed the income tax deadline from April 15th to July 15th, following the lead of the Congress to do that. Remember that July 15th moves us into a new fiscal year. So the borrowing that we're doing is really just a temporary borrowing that would then be paid back, based upon that income tax revenue that would come in 3 months late.
With yesterday's news about when the peak may occur, perhaps there might be if you could explain how do you define what a peak of the pandemic really is. So we talk about daily deaths, new confirmed cases, hospital admissions, or is it some combination of all of those?
Well, it's the metrics, many of the metrics that we've put forward in Restore Illinois. Those are things that we watch. It's the positivity rate, it's the hospitalizations and ICU bed utilization, the number of ventilators that are in use or available. Those are all things that we follow. The case numbers, I just want to point out, are a little less helpful because, and people seem to follow that number more than they do others, because very early on in the coronavirus crisis, that was the only number that anybody could latch onto. And it was numbers in the thousands in every state, or at least in the large states. The more you test, though, the more you find positive cases. If you don't test, and you should look at some of the other large states that aren't testing as much as we are, then guess what? You have fewer cases reported. So the fact that we were able to report that we reported 4,000 cases today is a function of the fact that we did 29,000 tests.
I want to lump together some of these questions of your authority, largely from members of the downstate media. Kevin Mansouri from the Belleville News Democrat says some downstate counties are mulling over resolutions to end their stay-at-home orders and begin their own phased reopening. Also, Joshua Vincent from the Clinton Herald WHBF TV says that an owner of a bar and grill in Savannah and Carroll County over by the Quad Cities is suing you because he wanted to allow people to eat outside of his restaurant at picnic tables that are 10 feet apart. And he also adds that Northwestern Illinois officials want safety, but they think that local municipalities should have more say on how they should protect residents in an area that isn't severe or urgent, something magnified by the fact that Iowa, it's business as usual. Your reaction?
Well, let me begin by saying that my job is to keep the people of Illinois safe, and also to tend to putting back the damage that this virus has done to our economy, making sure that our economy has the ability to grow. So I'm measuring those things very carefully and using experts to do it. The vast majority of those counties and individuals, those business owners, are not talking to epidemiologists. They're not talking to scientists. In fact, they're not relying on science in any way whatsoever to make their decisions. I would just suggest to all of them that they are putting the patrons of their businesses and the people who live in their counties or in their cities in danger when they simply break the rules, break the law, in fact, and they're decide that they want to go it alone. We are one Illinois. We are one state. We have 4 regions for the Restore Illinois plan, and soon enough, regions across the state will have the ability to move into phase 3. And so we're gonna keep focusing on the data and the science. Everybody should follow this data. And indeed, I think we're only about 13 days, 16 days, 17 days away from the ability for many people to return to their jobs, return to their businesses. But I just want to remind everybody, this virus is still out there and is still killing people. So everybody wanting to go, back and open up their businesses and just put people at risk willy-nilly needs to, take a look at the data, take a look at the science, and recognize that we're going to have more people in the hospital and more people dying if they don't follow the path of gradual reopening.
Governor Tom Wolf of Pennsylvania warned yesterday that counties who disobey state directives and reopen earlier than as the orders have been set could face the loss of withholding of federal aid to those municipalities, to those counties. Is that something you would contemplate?
We would consider that.
So you would consider the pass-through function of the state to provide federal assistance to state and local municipalities, cities, counties, if they don't follow these orders.
Well, look, the state already provides a lot of support for cities and counties. And so I would just suggest that there are a number of enforcement mechanisms that are available to us. And I don't want to utilize those. I have asked people to do the right thing. And I want to point out that the vast majority of people in Illinois have been doing the right thing. And I'm so very proud of that. And these people that you're referring to are the outliers. These people do not follow science or data. They're just, listening to, partisan rhetoric, perhaps. And following, their own instincts, but no science.
Doug Finke from the State Journal Register has a two-part question. Have you determined when state employees will be required to return to work from their normal work locations and not from home? And when that happens, will there be special requirements imposed, such as wearing masks or maintaining distancing in their offices?
Well, just in the same way that we look at the non-essential, as we've referred to them, businesses that will come back in phase 3. So people who work in offices, for example, in insurance companies or other consulting firms or other businesses that require an office, we want to make sure that we're doing the proper social distancing for state government workers too. And so we're considering all the ways to do that. We have teams of people who are reviewing how that will work for state employees, just as how it will work from industry to industry. And it is in those teams that we're determining what the best practices are, using the advice of our epidemiologists and outside epidemiologists to make sure that we're getting it right.
Couple of questions about gig workers and 1099 and the Pandemic Unemployment Act. Is there any update on how filing went for those workers yesterday? This is from Kelly Bauer from Block Club Chicago. Do we know how many people filed and were processed yesterday, and when those first filers will start receiving their benefits?
We do. I just got those numbers, so you'll forgive me. I'm going to look at them. As of today, 68,000 Illinoisans have accessed the new PUA portal. That's since yesterday morning when it launched. And over 50,000 applications have been filed. And so it is working reasonably well. It certainly has this system that was stood up is a more robust system than the existing one for regular unemployment that we've been building up, because as I have said many times, it was built on a 10-year-old platform, not expecting to take the kind of size of applications that have come in for regular unemployment. But this PUA system, which is built with outside assistance, is doing well, taking 50,000 applications in and 68,000 connections.
Jim Leach from WMAY has a PUA-related question. He said independent contractors and those with 1099s, first you have to be denied regular unemployment benefits before they can apply under the new PUA. But Jim says he's told that if those workers have even small amounts of income with a W-2, they are not denied and therefore ineligible under the PUA, even if the majority of their income is as an independent or 1099. Is the state aware of this, and can anything be done about it?
Well, these are rules that were put in by the federal government with regard to this PUA program. So it is something, I mean, I'm aware that there are a small, relatively anyway, a smaller number of people who are having that difficulty. That is something that I think we'll need to get a waiver from the federal government around. So, that's a conversation that we're going to have with our federal officials.
Okay. Two more questions. Molly Parker from the Southern Illinoisan says that in some of our downstate communities where, of course, you have public facilities like prisons, mental health, ED facilities, congregate settings. Yesterday, you said IDOC is not testing prisoners upon release because they would likely show symptoms in the days or weeks leading up to their release. Yet other states are finding huge percentages of asymptomatic people when widespread testing is done inside a prison. What is the state's plan for testing at these facilities of staff, inmates, residents, individuals being released, considering that these facilities could be an undetected source of spread in rural communities? And with that, as we move towards the next phase in reopening, if the state suddenly starts aggressive testing, it seems that could also provide an adverse impact on our metrics. And why not move to get a better handle on this now, considering the state has only tested about 2% of inmates?
Well, certainly, if we had unlimited tests available, we would be testing absolutely everybody every day. The fact is that we have to make decisions about how to use those tests, the ones that we have, because as Molly is pointing out, when we're testing even 29,000 as reported today, or 20,000 on average, the fact is that there's no way that you could test enough to know exactly whether somebody leaving a congregate setting or in a congregate setting from one day to the next might not or might contract COVID-19. What we are doing, though, is using all the best practices that the CDC has offered us to make sure that we're following whether people are symptomatic, whether if they're asymptomatic, following them for a number of days, taking temperatures, checking on their well-being. And even if, as they leave, even if you tested somebody as they were leaving a facility, that alone wouldn't actually tell you whether that person might turn up to have COVID-19 in the days forward. So I would just suggest that, what we're doing within the prisons is to try to make sure that we're containing the virus and keeping our staff, very importantly, our staff safe, as well as those who have comorbidities who may be prisoners or staff. But we're managing this as best we can. And when we have more testing, we will be expanding the amount of testing that gets done all across, not just our congregate settings. But remember, as you open up the economy, it's important for us also to test people who are going to work and make sure we have the ability to test people when we think that they may have been exposed several days hence.
The last question, Manuela Llorena from Univision Chicago. With all of these birthday celebrations, graduations, and whatnot sidelined because of COVID, would it be possible to hire a mariachi, for example, to play their songs outside of a house, provided they follow social distancing guidelines? Is that something you would consider?
Well, I am in favor of celebrations. Obviously Mother's Day was just a couple of days ago, and I know that there were so many celebrations that didn't occur because of social distancing, because people are trying to keep their own families, mothers and grandmothers safe. So all I can say is that I can't speak to the efficacy or the safety of a mariachi band, whether they could manage to stay socially distant enough and help people celebrate that way. And I'm not qualified necessarily to judge that. I certainly can ask, but I would say that I want to find ways for people to celebrate their graduations in particular. We've, in fact, through ISBE, we've worked hard to provide some guidelines for schools so that they could do something to make the day special for the parents and for the kids. I know how hard this is on young people here at the end of the year not to be able to have the normal kind of graduation. And so we want to work with people to make that a special day for them.
Okay, we will go to questions from online. Amanda Vinicky at WTTW. Governor, have you spoken to Speaker Madigan and President Harmon and told them the General Assembly should return? If not, will you? Has a date been set or even a week of session been set? Should it be before the end of May?
I have spoken with all four leaders about getting the legislature back together. I have spoken with President Harmon, as you asked, and with the Speaker of the House, and encouraged them to do so. And yes, I think it would be best if they could get together before the end of May so that we can get the very necessary things done, like our budget.
Scott Miller at WJBC Radio in Bloomington. You announced the peak for COVID-19 may not happen until June. The McLean County drive-through testing facility was supposed to be open until the end of May there. It was just announced that it's closing early. Why?
Well, there are multiple locations in Bloomington. You and I, Scott, had this conversation on your radio program, and it's important to note that there are multiple locations that are available to people in Bloomington. It's one of the reasons that there were only about 26 people a day going to the drive-through. That, you know, these drive-throughs in the rest of the state were getting 500, 600 cars a day. And so we want to make sure that the most effective locations are chosen. And make sure people have the ability to get tests. And since Bloomington does have a number of locations already available, we want to make sure that we find other drive-through settings that will allow us to capture more and more tests.
Rich Miller at Capital Facts. Your plan requires regions to have downward trends in positivity rates for 14 days and downward trends in hospitalizations for 28 days. Why must that region begin on May 1? If a region has already met those conditions, why must it wait? Please explain the science.
Well, two things I would respond to here. One is that actually we don't require downward trends. We require stability. So that's what what we look at. And as to the 28 days versus 14 and May 1st as a start date, remember, we changed a lot in our stay-at-home order on May 1st. We opened up state parks. We opened up golf courses, again, with guidance and safety conditions. We want to make sure that people are safe in those settings. We opened up elective surgeries in all across the state. And we also allowed retail to provide delivery and to provide curbside pickup and such. So there were a number of changes that were in that stay-at-home order, and we wanted to make sure that we had a solid baseline. I also would point out that if we had followed, as I said earlier in this conversation, if we had followed the guidelines that were set in the White House plan and that have been adopted in some other states and required a downward movement of all those numbers, we might not be reopening some parts of the state, any parts of the state really, until perhaps the middle of June or later. But instead, we looked at the hospitalization numbers, we looked at the hospital capacity, and said that if we could maintain stability, we would have some comfort that we would be able to absorb any surge that might take place when and if we move into phase 3. And I expect that we will move into phase 3 for most of the state on May 29th.
Hannah at the Daily Line. Governor, aside from the 15 Abbott Labs ID Now rapid test machines the state got back in early April and the 5 Thermo Fisher machines, has the state received any more equipment for quick COVID test results, either from Abbott or its other competitors? When will the state see greater availability of tests, especially these rapid tests, since your Restore Illinois framework in part depends on the expansion of testing?
Yeah, the expansion of testing is hugely important. And, people don't give these machines away very often, just to be clear. When we're acquiring machines, they're expensive to acquire. The federal government did provide us with 15 of these rapid ID Now testing machines. And so we're deploying those in the appropriate locations. We weren't given the cartridges that are required, only about 100 or so, 120, I think, cartridges for 15 machines. And so we had to, go acquire many more of those so that we could use those machines. There was another problem with those machines that I wanted to point out, and it was just resolved over the last week or so. And I spoke with Dr. Birx who's, works with the president and others, and Dr. Fauci. But Dr. Birx and I spoke about what was happening with the ID Now machines was there was a kind of a lot of false positives and false negatives that were coming from it because people were not instructed to use it in the way that would be most effective. Really, those machines need to not have people providing a sample and then having that sample transferred in a VTM to another location. You really want to do it in the location that the machine is in and not use a viral transport medium, because that has an effect on these tests. That wasn't a problem for Illinois. That was a problem nationally. I spoke with governors all over the country who were having that. That issue has been cleared up by Abbott. And so those machines are now, much more useful for us and more reliable. But I want to also add that you don't have to buy multi-million-dollar machines or millions of dollars of machines necessarily if you can arrange partnerships with those who own the machines and operate them, as we have with hospitals like Lurie and others, because they have capacity. They often buy machines so that they have them on site so they can use them in their hospital for their patients. That was before COVID-19. They weren't really taking a lot of outside tests and running them. But in this era, in this crisis, it's critically important that we use all the capacity that we have. Problem that we had before was no supplies and no help from the federal government to get supplies. Now we've been able to get supplies on our own mostly, and we use those supplies in partnership with the hospitals using their capacity to get testing done. In addition to all of that, again, for spinning up more testing, there have been companies like Redditus that have expanded significantly. They're in Pekin, Illinois. We talked about them the other day in one of our daily updates, as well as other private labs that have expanded their provision of tests. And again, we're partnered with them to make sure that they're getting the swabs and specimens so that they can run those tests. I mean, we really have done, I think our team has done a good job of using the available capacity without getting help with supplies. We've been able to spin up the supply chain and make those partnerships ourselves in order to expand testing significantly.
Molly in Peoria says that they're getting a lot of calls in Peoria asking what the current rules for dental offices are. What types of services are they allowed to offer right now?
Well, we just issued over the last couple of days new guidance for dental offices, and they're able to do quite a lot under that guidance. I would direct you to the IDPH website for a issuance of that guidance that just came out.
Pete McMurray at WGN Radio. Restaurant owners are asking why the general public can walk into grocery stores, touch produce, walk around, but can't social distance at a restaurant at 30% capacity. What's your reaction?
It's a great question. Remember that grocery stores are open because they've been deemed by the Department of Homeland Security as essential services, essential businesses. So are pharmacies. And I know that people look at that and say, well, gee, I see a lot of people in a grocery store, but how come we can't have a lot of people in XYZ retail or other business? And the real reason is because remember, when you put a stay-at-home order in place and you limit people's ability to access businesses, it's because you want people to stay home. It's because you want people not to have those interactions, or at least to limit the number of those. And it is unfortunate that people were packing into grocery stores, not wearing masks sometimes, and that's still happening to some degree. There's very little you can do except to have the grocery stores enforce 6-foot rules, enforce the mask requirement, the face covering requirement. And it's not to punish anybody else, but if the Department of Homeland Security had not said that grocery stores should be open, I'm not sure how people would be able to stay at home and provide meals for their family.
Shruti would like to know if this is a new high for cases today. Dr. Ezike, do you want to take that one?
Yes, in fact, it is. Obviously, we have not had in the 4,000 range before, but we also have never had tests in the 29,000 range. So again, there is a proportionality there that as you test more, you're going to get more positives from within those additional tests.
Okay, and then this will be our last question today. It's from Shia. Given baseball owners have a plan to start games in July, what do you tell Major League Baseball players who want to haggle over salaries, even if all the safety precautions are taken?
Well, I realize that the players have the right to haggle over their salaries, but we do live in a moment where, you know, the people of Illinois and the people of the United States deserve to get their pastime back to watch anyway on television. You know, if they're able to come up with safety precautions, as has been suggested by Major League Baseball, that works, I hope that the players will understand that the people of our United States need them to recognize that this is an important part of the kind of leisure time that all of us want to have during the summer, to watch them play baseball, to root for our favorite teams. We need that back, that normalcy back, and I hope they'll be reasonable as they negotiate. But I must say I'm disappointed in many ways that players are, you know, holding out for, you know, these very, very high salaries and payments during a time when I think everybody is sacrificing.
All right, everyone, that'll conclude our daily briefing for today. Thank you so much. We'll see you tomorrow.